I want to thank you all for staying and listening, but I think this is going to blow your minds for any of you who have never heard of the concept periods optional. And so, as a doctor, as a woman, as a person with a uterus, I realized in trying to get pregnant with my first baby that the only reason those of us with uteri bleed every month is because we're trying to catch an embryo. So we build up that lining, we're like, embryo, oh, no embryo, bleed. And we do this every single month from 12 and a half to 52. But we only try to catch like 2 embryos in our life. So why are we doing this for 40 years? So we're going to talk about today really briefly, because I know you all want to leave and you got to go. But we can talk afterwards as well, why having stable hormones is a peak performance strategy. So as you know, as female athletes, you're training, you're competing, you're performing at elite levels, you're doing all sorts of things to make yourself the best player possible. You got to think fast, you got to move. And there's some people that are hacking it by going up to like Colorado to maximize their hemoglobin, to maximize their oxygen. But did you know the number one cause of anemia and thus low hemoglobin, low oxygen is bad, evil periods? And the number one cause of missed work, school, sport is bad, evil periods. So if I took away your periods, then you might be 25% more productive, or you might have some friends that might be more productive. And oftentimes as athletes, we're told to power through, but like, I don't believe in sucking it up. Hashtag stop sucking it up. We have drugs. We have science. Let me help you. Don't suffer. What if periods weren't a problem? What if you could perform better because you understood your body? Because you had the tools to do whatever you want. So you can get a competitive edge by deciding when and how often or if you bleed every single. And there have been many athletes who had PMS, some famous athletes that are known to just go off during their periods. And we'll have some other quotes coming up here, sprains and injuries. So people are like, wait, aren't I supposed to bleed every single month? And yes, doctors like to know if you're bleeding every single month, but that was in the old days when we didn't have other stuff that we could check. You just want to make sure that you don't have an eating disorder. I don't know if you guys have had a lecture on relative energy deficiency of sport, that if you don't eat enough, then you lose your periods, but that also means you don't have enough energy to run as fast as you possibly can, to make decisions really, really quickly. And that's why they want to make sure you eat enough to get your period, to make sure you have enough energy to play whatever sport you want. But it's actually natural to have fewer periods than what we're having today. So if you were to go and study the Dogon tribe in Africa today, a woman, Beverly Strassman, does that. They die the same time we do. They have 100 periods in their lives. We have 350 to 400. We have enough periods for 2 or 3 other people. And the reason why is the natural state of the female animal, per my OB/GYN professor, is pregnant or breastfeeding. How many periods you have when you're pregnant? 0. How many periods you have when you're breastfeeding every 2 or 3 hours? 0. And so in the old days, we'd have 8 children and we breastfeed them for 10 or 12 months. Now we're having 2 children and we're breastfeeding them for 0, 3, or 6. We should breastfeed them for as much as we possibly can. But I don't want you all to have 8 children necessarily, but we can mimic the state of pregnancy with the birth control pill patch or ring. Every time you build that lining, it could turn into cancer. Every time you pop an egg, the popping, the healing, the thing has something to do with tube, can turn into ovarian cancer. So if you turn that off and don't do that every single month, you decrease ovarian, endometrial, colorectal cancer. But most importantly for you as athletes, you decrease anemia because you're being bloodlet 1 week out of 4. The number one cause of anemia in a menstruating person is menstruation. So if we can stabilize your hormones, and that's the way the birth control pill, patch, ring, IUD works, is stable hormones. And then 1 week you can come off and have a bleed, but that week you could do every month, every 2 months, every 3 months, never. I didn't have a period for the past 16 years since my last child because I was like, I don't need to catch embryos. I don't need to do this every single month. Why bother bleeding? And so if you don't bleed, then you have stable hormones and then you have more hemoglobin, more oxygen so that you can make that fast thought, so that you can make that right decision, so you can run faster and do better. There's a quote from Megan Rapinoe. She had 3 ACL tears, all on her period. I was like, who's your doctor? Because if I were your doctor, no way would you be bleeding anywhere near any game. And, without the bleed, maybe she wouldn't have those tears. So the science, as I've emphasized, is more blood, more oxygen, faster thinking, better flow. And then the joint part. If you don't have bleeding, maybe decreased ACL tears. The brain science is that periods can mess with you, right? Who's had like a bad day because of PMS or like weird munchies or just cranky? Like nobody's happy when the blood's coming out of you. It's your body, your choice. If you want to bleed every month, go right ahead. But I want to tell you, I went to MIT, UCSF, Stanford. I'm a clinical associate professor. I specialize in adolescent medicine. We call it sex, drugs, rock and roll, little acne, some sports medicine. So this isn't some rando trying to shove drugs down your throat. I'm just here as woman to woman, uteri to uteri, that if you don't want to bleed every month, I want to give you that option. So think about it this way. You can exercise dealing with that cycle 1 week out of 4 or even 2 weeks out of 4 messed up. Or you can just go smooth. And the goal isn't, a lot of people might have heard cycle syncing and like, oh, what cycle? Like, how am I going to eat? How am I going to exercise? It's like, let's simplify. Let's just make it flat. Then there's none of this, oh, I'm in this part, I got to do this. I'm in this part, I got to do that. I'm in this part, I got to do that. Just like, it's flat. It's calm. It's good for your mood. It's good for your energy and your blood. So periods optional is a legit, safe option. So smoothing hormones smooths your ups and downs, and you can play at your best. And as you know, you might have seen that Amber Glenn at the Olympics was like, I'm on my period right now, and it messed me up. And I was like, again, girl, who's your doctor? Because if I were your doctor, no way would you bleed at the Olympics. So just like how we do this with the birth control pill, patch, ring, or the IUD. And so some people are like, hormonal birth control is not safe. It's going to make me infertile. So I want to go there. It's going to make you infertile while you're on it, because that's why most people are taking birth control. But as I sort of explained before, the way the birth control pill, patch, or ring works is 3 weeks hormone, 1 week off. And when you do that 1 week off, if you've done it, you bleed on day 2 or 3. Why do you bleed on day 2 or 3? Because the hormones have left the house. That's why you bleed. So it is out of your body in 3 days. If you want to be anal retentive, any of you all pre-med or whatever, pre-health, we can talk later. Pharmacology, it's out of your body in 3 half-lives. So at the very least in 9 days, those hormones are out of your body. And then to re-emphasize it doesn't make you infertile, I gave a talk on birth control pills to a bunch of infertility specialists. And I'm like, why am I going to talk to a bunch of infertility specialists? 1 in 10 of us born with a uterus will get something called PCOS. And that's where your periods are irregular, you get hairy, and you get zits. And those people's hormones are like this. And how do we as physicians calm them down? We put them on the birth control pill, patch, ring. And they're told when you try to get pregnant, it's going to be a hard time because your hormones are like this trying to get pregnant. And so they're like, oh, well, I got to come off the birth control, wash that out of my body, and then get pregnant. No, for them, this is as normal as they're going to get. As soon as they come off, that's the time to get pregnant. So the fact that infertility doctors are using birth control to help people get pregnant show you that this does not make you infertile. The only one that hangs around is if you get the shot. If you get the Depo-Provera shot, after 3 shots, it may take 8 months to wash out. So if you want to get pregnant in the next 8 months, do not do the Depo-Provera. But all the other ones out of your body in 3 days, but definitely by 9 days. So it doesn't make you infertile. Number 2, worried about you're going to gain weight. Research has shown that if you have 100 people on the pill, 100 people not on the pill, the 100 people on the pill weigh a pound less. Because they're not blown up, floating down, blown up, floating down. They're just this. Person over here blown up, floating down, blown up, floating down. So does not cause weight gain. But know that there are 40 different birth control pills, 8 different progestins. So a person might interact differently with a particular progestin. And so if you take this progestin and it gives you the munchies, then don't do that one. Tell your doctor, I don't like this one. It gives me the munchies. I will do these over here. And I just want to share as a woman of color, I realize that all of medicine, most of us physicians do know, that most of medicine is based on a 70-kilo white man. And certainly not for birth control. But it's a Caucasian woman that this is based on. And this is how we teach medical students and residents today. Here's a pill your professor likes. If it doesn't work, have a backup. And if it doesn't, good luck with that. But I wrote 3,000 birth control prescriptions over 2 years. And coming from MIT, UCSF, Stanford, I was like, women are having side effects, particularly women of color. But women from Black background, women from Asian background, Latina, this pill works great if you're Caucasian and you want to bleed every month. But if you're anything else, it doesn't work. So I took all 40 pills because I love spreadsheets and ranked them. Most likely make you bleed, least likely make you bleed. Most likely give you munchies, least likely give you munchies. Most likely give you zits, least likely give you zits. And with the variables, how old are you? Because we want to make sure you get enough estrogen for your bone health. And do you have acne? Is that a concern? And race as a proxy for genetics. 93% of our patients are happy with the first pill prescribed. So none of this guinea pig tested trial crap. Bam, got you 93% on the first one. And then if not, our doctors know how to tweak it. Like, oh, you got like zits on that one? Okay, let's take this down. Oh, your libido went sky high and you don't want that? Let's take this down. Or went low, we'll take it up, So we have the only company out there that can pick the best birth control pill for you, given these parameters, tailored to women of color. And then last one, side effects are inevitable. No, you don't have to have side effects. If your doctor knows their stuff and has this chart and knows how to play with stuff, I bet you we can get you to 0 or minimal side effects on that. And this is about supporting you. This is really my gift to the world. I have a TEDx talk. You guys can pick up cards. It has a little panty with blood on it. It's like, you don't have to have this anymore. Gave it at Berkeley. Thank you, Berkeley, for that opportunity. And my goal is just to tell everybody with a uterus, if you're bleeding every month, that's from 2020. We got drugs. We got science. You don't have to do that. If it brings you joy, go right ahead. But it will increase your risk of ovarian, endometrial, colorectal cancer, and anemia, and may not put you at the top of your game. So stability is a team strategy. If all your players are just smooth, no drama, and as you know, sometimes as a bunch of women, we gather together, we sink, right? Like, that's not cool either. If your whole team's on the period, that could be one ugly situation. So talk to your coach, talk to your trainers. Less guessing, more precision. We have an opportunity, athlete performance ambassadors, and it's limited to the first people to sign up. This is our pilot study. As an ambassador, the athlete gets free consultation. It's asynchronous. You just fill out a questionnaire, and we pick the best birth control pill for you and turn off your periods, or just let you know you can move your periods around and schedule them wherever you want. And then in return, you also get to have a meeting with me monthly to just check in on a Zoom, not one-on-one, but as a group, because my time is precious. And then we'll have some guest speakers and stuff like that. So if any of you all want to sign up yourselves or sign up as a coach, we have a QR code. You guys can hopefully come up and scan this, and then you can send your personalized code to your team. I'm also happy to give my periods optional lecture to any all teams, so I would love it if I could do them all at once, but I'm happy to do one off as well. So that's it. And if any of you all have questions, please take our swag.